am Professor Channaraya, consultant at Sagar Hospital in Internal Medicine Department. Today I will be going to talk about dengue fever. Now let us discuss what is dengue fever. Now dengue fever is a viral disease basically transmitted by the mosquito. Now we have 4 types of dengue virus, that is 1, 2, 3 and 4. These are the 4 serotypes which are different in the antigen and antibody properties. How does this disease, that is dengue virus, is transmitted? It is basically transmitted from man to man by mosquito bite, that is Aedes aegypti mosquito, which is basically bites during daytime, that is nothing but dawn to dusk. Where does this mosquito breeds? Mosquito breeds basically in the clean water, especially in and around the house. It may be in the AC water or the pots which you keep in the house, or the tires or coconut shells in and around the house. It does not breed in the lake or the storm water drain. So, you need to know that these mosquitoes breed around the house. Now, can we recognize this mosquito? Yes, we can recognize this mosquito. It has different appearance compared to the other types of mosquito. It is otherwise called tiger mosquito because of its alternate black and white bands on the stomach of the mosquito. Now, how does these people present to us and with what properties we have to identify, or what clinical features will tell you the patient has got dengue fever. Now, whenever a person has got fever, body ache, back pain, eyeball pain, skin rash, that is color change in the skin, itching, severe abdominal pain, vomiting, nausea, this is the symptoms of dengue for which commonly people with dengue fever can come. Now, the other problems with dengue fever is complicated dengue fever. Now, whenever they develop complications like bleeding from the nose, bleeding from the mouth, or passing blood in the stools, or passing blood in the urine, or the bleeding manifestations of dengue fever, which are dangerous to the mankind. Now, other complication can be dengue shock syndrome. Whenever they develop the low blood pressure, skin becomes cold and clammy and heart rate goes fast, we call as dengue shock syndrome. Now, when should patient get admitted to the hospital if they have dengue fever? Now, whenever they have complications what I described, that is dengue with bleeding or dengue with shock, they need to get admitted. Or patients who have severe abdominal pain, persistent vomiting, or if they have breathing difficulty, or if their sensorium, that is conscious level, is decreased, all these patients needs to be admitted in hospital and treated as inpatient. All other patients we treat as outpatient. Now, what are the tests we do to identify the dengue fever? Dengue fever is identified by basically the blood test. We do dengue NS1 antigen, IgM antibody or IgG antibody tests are done. Depending on the different stages of illness, we do different tests. In addition to these tests, there are other blood tests we do, that is blood count, which shows the platelet and hemoglobin level, from which also we will be able to identify. If WBC count is also low, then also we can identify. And other blood tests we order depending on the other liver, kidney or lung problems, we do X-ray. If they have heart problem, ECG. So, any organs if they are affected, depending on that we do the various other tests. Now, how to take treatment for dengue fever? Now, majority of the patients does not have complications, they can get treated at home. Simple measures at home can be drinking lot of water, fruit juice. Because of the eye fever there is loss of fluid in the body. So, they need to take these eye fluid or eye water content. In addition to that, they have to take paracetamol, that is crocin, dolo or calpol, any of the tablets which will help to reduce the body pain or fever as useful. Now, please avoid taking painkillers, that is the non-steroidal anti-inflammatory drugs, and there is no role for corticosteroids in these patients. Now, when does these patients get admitted? We monitor regularly. If they have complications, they need to be treated as inpatient. Again, inpatients we divide into severely sick patients and those who do not have the complications we treat in the wards. Now, we treat basically with the IV fluids, supportive treatment. Now, whenever they have complications, we go for other treatment modalities. Now, when does these patients require blood or platelet? If they have severe bleeding, then they require blood, or if the platelet count is less than 10,000, or if they have bleeding manifestation, then only the platelet count is low, we use the platelet transfusions for such patients. Otherwise, platelets are not indicated in all the patients in dengue fever. Now, coming to how do you prevent the spread of this disease or protect from the dengue infection? Now, there are different measures we take. It may be physical, it may be chemical or biological measures. One has to protect themselves from mosquito bite. They have to use the mosquito nets, mosquito repellents. There are a lot of other things we use to prevent mosquito bites. You have to take such measures to avoid mosquito bites. Wear proper clothing, full sleeves and cover the legs, especially when they are daytime sleeping, because the mosquito bites in daytime. So, they need to be protected, especially children and elderly who sleep at home during daytime. They need to be protected from mosquito bites during daytime. The other measures we take is the insecticide spray to prevent the mosquito breeding and keep the surrounding clean, and especially the government has to take significant measures to spread of this dengue infection. The last word about dengue is, now we need to educate lot of our people about the dengue fever. Now, we have to use different media. It may be in the form of TV or in the radio programs or public awareness program or print media, or we have to use various digital platforms like Facebook or Twitter or the WhatsApp. So, through this we have to spread the message to prevent the dengue spread, and by putting all our efforts, let us reduce dengue fever in the community, because it is highly endemic in our country and we need to bring down the dengue infection. Thank you.